Lynch, and I'm a fourth-year student on my APPE rotations currently. And myself and my classmate Kelly Ray Tolbert, with the assistance of Dr. Sarag and Dr. Wantuck, put together this short presentation to go over an introduction for order processing. So there are going to be a number of items you're going to want to check before approving an order for a medication, and all of them are going to be utilized to ensure patient safety and optimum patient care. As we talk about the checklist of items, we're going to incorporate a sample patient profile to help simulate this process. And so, to get things started, let's discuss some of the aspects of an order that you're going to need to confirm. The checklist to have in mind should be inclusive of all aspects of patient care, with some of these major categories being the patient identifiers, allergies, indication for the drug, SIG code, which should include the dose, route, and frequency of the medication, as well as any potential compatibilities or drug-drug interactions. So the first thing that we're going to do to get started is look at a pending order. So in the software, we'll see this verify queue. This will be a list of orders that are in need of a pharmacist to verify. So we'll see this order right here. It's been sitting in the queue for 13 hours with the generic patient name, so we can go ahead and check that out. And we see that it's an order for enoxaparin, 60 milligrams twice daily. So that's a blood thinner, and we see some brief provider information over here on the right, and then we can see who the order was actually created by and entered by, and it was the pharmacist on duty. So after we pick the order that we're going to start working on, we're going to look at patient identifiers. So we see who it's placed for. Go ahead and open up their profile and make sure we identify that the name is correct, and look at any other patient identifiers that might be helpful in confirming that information. You usually want to get at least 2 patient identifiers. Another option is the MRN. And the MRN is going to be the medical record number, which is specific to that patient. So we also see the date of birth and age up here for the patient. So those can also be useful. And then there are other portions of the chart which can include scans of their driver's license or their home address or other things that can be unique in identifying the right patient. Next up, we're going to want to look at allergies. So will be drug allergies, but food or environmental allergies will also be beneficial and to keep an eye on and keep documented within the record. It's also important to know how severe the allergy is. That might help separate true allergies from just unwanted side effects or pseudo-allergies that are improperly reported. So here we can see that the allergies are listed in this bright yellow box up at the top of the screen. And then if you click on that, or you can click on this tab on the left, which is the allergies section, it expands it a little bit, and it still lists the 2 allergies, but it tells you what reaction type they have, and then as well as when it was documented. So that might give you an idea of how long they've known about this allergy, or if it's ever been challenged with medications that are close by or related to the drug in question. So with our enoxaparin, that's what we're looking at, we see that this patient has no allergies to enoxaparin or anything related to it. This is an antibiotic that we'll keep an eye on, and then the adhesive, which may come into play just if there's any IV lines that need to be taped down or anything like that. But we're in the clear for enoxaparin at this point. Next up, we want to look for the indication. Does this patient actually have a need for the medication that's written? So here we can see in the notes, we get a little bit of background on why the patient is in the hospital. So right now we can see that they had a CT angio, and the final read finally returned and they were positive for a pulmonary embolism, so they were asked to come back. We know a pulmonary embolism is a type of blood clot, and that enoxaparin is a blood thinner, so that is appropriate therapy for treating this patient with this medication. So here we have it, the indication. This can be a little bit tricky, so you can see there are a lot of different areas, progress notes, consults, procedures, but the history and physical will give you a good idea of what's going on for this visit, and we've already found the indication we're looking for. So in their past medical history, if they do have other chronic disease states, it is also good to keep an eye on those just in case you need to continue any other medications in their hospital stay. But at this point in time, we're just worried about the enoxaparin for this example. Next couple of checkpoints will be the SIG codes, which will be the overall instructions for the medication, and it should include the dose, the route, the frequency, and the duration of how long this drug will be given. So here we have our list, and we can see medications. We have this enoxaparin that we've been looking at, the 60 milligrams. We see the dose column, and this dose column will represent all of the different drugs that they may be on. So we have the 60 milligrams, which is correct for what it was written for. The route is the subcutaneous, which is correct. Frequency is twice a day, which is good for the treatment of this pulmonary embolism. And we see that the doctor wants them to start on March 10th. At this time, there's not particularly an end date because this will just be used as a transition drug, really, and so we'll have to wait until some other more chronic drugs like warfarin can be stabilized before we'll discontinue the enoxaparin. And then, again, we see that this is just part of the pulmonary embolism order set, so that may be bundled with a couple of different drugs, and this is just a snapshot of the medication list that they are on at this time. Looking at the other drugs, you can see that different doses are written different ways, whether it's in volume of milliliters or milligrams. Again, with the route, we can see some are given intravenously, some are given orally, and this one, the enoxaparin, is given subcutaneously. We also want to look at some of their lab values. In particular, with this drug, the serum creatinine will be big. We're going to look at their renal function and making sure that they're going to be able to clear this drug okay, and we're not going to have any accumulation that may be causing side effects or any excess bleeding for this drug in particular. And we can see this is just a typical way for the blood chemistries to be reported. We can see all the other electrolyte levels, liver function test, any other proteins that may be used in binding medications. So up next is the compatibilities. This is going to be used to see what you can mix the drug in. So enoxaparin is pretty straightforward. There's usually a pre-filled type of pen or syringe really that's going to be looking at because it's going to be injected subcutaneously. So you can go into Lexicomp and look into enoxaparin. This is the little guidelines for how to read their report, and then we see that with this report you can either be unsuspended or you can mix it in normal saline, and that'll be adequate. So generally speaking, it'll be already packaged, and you just pick out the right size pen as far as what dose you need, and instruct the patient or educate the patient on how to properly administer it. Another example of a compatibilities table, we can see with Micromedics it's slightly different, but we see what compounds are okay to suspend the enoxaparin in. And so here we can see that Micromedics has it okay to be made into a solution with dextrose, D5W, or normal saline. Again, they should be coming in the pen, so it should be already taken care of. Drug interactions. So this we will look back into the drug list that we saw on those previous slides, and we're going to go ahead and plug that into a Lexicomp interaction analysis. On top of this, you are going to use your clinical judgment. So we can see with these, there are a couple of, they're on aspirin, with the enoxaparin, that has the potential for excess bleeding because those are both blood thinners. Then there are a couple of other interactions that we want to keep an eye on, but generally we're just going to monitor this therapy and make sure that there are no unwanted adverse effects. So really, with all of this information that we have pulled together so far, we have the patient, we have the drug, we know their allergies are not a problem, we know the drug is a correct therapy for the condition that they have, the dose, the route, the frequency are all appropriate, and we've looked at the safety complex, the safety of compatibilities and potential interactions. We can look and we can approve it, and we can see here we have active orders, and our enoxaparin has been loaded up correctly. This is the other list of their medications. There are no other orders that are waiting to be verified, and so we can go ahead and move forward. The thing to keep in mind is just the provider information. So making sure that the attending physician is aware of orders that are being placed and approved, and then in different facilities it's set up differently, but especially for outpatient, just making sure that the DEA number is a viable number, and that everyone is acting in accordance with legal and ethical guidelines. The order process begins with patient identifiers and allergies, and then moves to more in-depth looking at the patient profile to find indications, the SIG codes, doses, routes, frequencies, and then just making sure that the safety of the patient is always maintained, and making sure that compatibilities are met, and you're avoiding any potential drug-drug interactions. So once you're satisfied with the information you found, you can go ahead and verify the order, prepare the medication, and dispense it as needed. Verifying orders in this fashion will help you understand the patient regimens and answer any questions that nurses or physicians may have in regards to administration concerns. Thank you very much. I hope this was helpful, and best of luck in approving orders in the future.